Doctors and surgeons of Reddit, what was your this just got even worse moment with your patients? Was coding a patient in room 1. I bring the family in before I call the code if they want, so they get a chance to say goodbye before I stop. Wife was clearly gone, had probably died hours before. Husband comes in, sees her laying there, grabs his chest and down he goes. His was a ventricular arrhythmia VTVF, ultimately resuscitated. I saw him a year later for something unrelated, and he thanked me for saving his life and told me he wished he hadn't lived because life without his wife wasn't worth living. I doctor here you may have heard that diabetics need to have their eyes checked regularly because diabetes is actually a blinding condition. This happened probably about 15 years ago, but this patient of mine I had noted had severe diabetic vascular changes against the retina and required laser intervention as soon as possible. Without getting into the socio-economic arguments here, she scheduled her surgery and on the day of the surgery decided to take a work day instead of her surgery. Her job was cleaning, and on that fateful day, she inhaled some of her cleaner fumes which caused her to sneeze, spiking her blood pressure, and she blew the fragile blood vessels in both of her eyes wide open and blood started gushing into her eyes. As you might imagine, blood is opaque. You can't see through it. She was instantly and completely blinded in both eyes in a matter of seconds. It took 3 years, multiple surgeries, and a complete lifestyle change. But this patient did recover to have actually fair, but not good vision. I still see her now for her annual visits. So many. The 80-year-old who came in with a self-inflicted shotgun wound to the chest. As we are fighting to get him stabilized, and the surgeons are working to plug all the holes, none of us can figure out why the guy keeps oozing blood. Then we find out that he had intentionally overdosed on blood thinners before shooting himself. We kept him alive long enough to let the family come into the OR and say goodbye. The 45-year-old who came in via private car family drove him in, rather than an ambulance, after what was described as a head injury. We realized how bad it was when someone noticed a plastic grocery bag lying on the patient's belly. It contained the brains that the family managed to scoop up, in the hopes that we could re-implant them. The 30-something meth addict who also had a permanent catheter, infusing life-saving medication directly into his chest for pulmonary hypertension. He came into the ICU with pH crisis, and then we found out why he had been injecting meth into the catheter, creating a hole through which his life-saving medication leaked out. Medicine is a lot of things. Sometimes it's just tragic. A little late to the party, but I'll chime in. When I was a medical student on my surgery rotation, I was working at 24 and was with the trauma team. I'm observing a simple repair of a duodenal perforation in the OR when my trauma pager goes off. Ask my senior if I can leave to see what's going on, and he gives me the go ahead. Run into the trauma bay and a youngish gentleman is brought in on a stretcher with the lower half of his body covered in blood, but very obviously awake and coherent. He's screaming, "They shot my balls. They shot my duck in balls, man." And they had. He had been shot 15 times all below the belt, one of which had gone straight through his scrotum. We are doing an evaluation on this distraught man when a code is called in the next pod over in the ed. That's weird, they usually don't call overhead for codes in the ed. Someone pops their head into the trauma bay. It's the patient who was brought in with this guy. Oh duck. Several of us run away from stable scrotum shot guy and into the next pod to see a young woman lying on a stretcher receiving CPR. What happened? We don't know, she just crashed. Go to roll the patient to get her clothes off, and we notice she's bleeding out of her back out of the tiniest exit. While she was an unintended victim of the drive-by, she's now our patient. We take her to the trauma bay and immediately take off all her clothes to perform the primary surgery. She's not breathing and has no pulse intubate. Sure as shit, once we get her entirely exposed, we see a very small entry wound right into the center of her chest. Ultrasound confirms massive hemothorax. Place a chest tube and 2 liters of blood gush out onto the floor. Oh duck. We need to convert to open, says my attending resident I'm with. Immediately takes a scalpel and creates a longitudinal incision along the inferior aspect of the rib spaces and uses a pair of medical gardening shears to clip the sternum in half. Basically, The patient has had their chest pried open horizontally in a crazy procedure called a clamshell thoracotomy. Look it up. At this point we can visualize the heart and notice there was a clean entry and exit wound straight through this patient's heart. All of the blood and fluids we were pushing were just draining right out of her heart and into her chest. Surgical attending is performing manual cardiac massage CPR with your hands on the actual heart. We need to go to the OR, rush down to the OR with this patient, and the attending attempts to sew up the holes in her heart. Just as she's putting the final sutures into the patient, I begin to notice the patient using blood from every single opening in her body. Doc, I think this patient is in DIC. Oh doc. Patient is now floridly experiencing a phenomenon known as disseminated intravascular coagulopathy DIC, which is basically when you use up all of your clotting agents and just bleed out of everywhere. Okay, we need to close for now. Patient is transferred to the SACU where I monitor her progress for 3 weeks. She has watershed infarctions across her entire brain from how long it went without perfusion. She can't talk or move. Having end of life discussions with the family about a young woman who isn't even old enough to drink. I leave the service and follow her until one day I don't see her name anymore. Next day I'm in a surgery with the trauma attending and she says, hey, our shooting patient went home today. She's a quadriplegic, but she's alive. That sucks. I respond. Fast forward 6 months and I'm working in the SACU again. I bring up this patient to a neurointensivist attending because I think it's a cool story. Her eyes opened so wide. I saw that patient in the ICU and told the family she was going to die. When she didn't die, I told them she would be a quad. Then a month ago I had a follow-up visit with her and she walked into my clinic with nothing to show for her experience except a scar from her thoracotomy. I've seen so many brutal ICU situations with immediate family. Car crash, fell off building, drugs, psych ward, cancer, stroke. The worst by far was my mum. She was in ICU following her 3rd abdominal surgery to remove cancers. It's so complicated and haunting, but her organs were pickled sick, and in the end they actually didn't find cancer. She was an alcoholic. She's still alive and now sober. It's the 3rd time they phoned me to say she is bleeding out and I should come in. She doesn't die, just keeps on going. The worst thing was the way her body had blown up to more than double its size, and it was bright orange. Her entire body from feet to face was unrecognizable. She was in an induced coma for weeks like this, and when she was woken up and had all the tubes removed, I thought it would be good. She couldn't communicate. We eventually used a notebook. With extreme difficulty, she didn't know where she was, why she was sick, and she said that people had been raping her day and night and that she wanted to die but was not ready. So I had to handle all of this, plus my family's general insanity and complete fallout. Obviously nobody was abusing her. It took about a year to get her home and have her understand what happened. That she went in one night for abdominal surgery and didn't come home for more than a year. She has a ragged, thick, nasty, uncomfortable scar across her abdomen that looks like a flip-top lid. She now lives a fantastic healthy life and reads a novel every day. She's absolutely extraordinary. I love you, modern medicine. I hate you, alcoholism. Not a nurse, but my mother was. One time while she was working in the emergency room, she had a patient find out he had an inoperable brain tumor after having a seizure. His wife was with him and was carrying in her bag. This was the late 80s, and he asked her to go to get something from the gift shop. While she was gone, he took the gun and shot himself in the head. And my mom describes it as looking like a peacock's feathers of mush and blood. The worst part is that he didn't die. He was brain dead for about 2 days before pulling the plug and actually dying. My father went to hospital with chest pains. They decided to do an angiogram. Dye injected. He's lying under the machine and the surgeon suddenly changes his procedure. Are you okay? Feeling well, Eddie? Blackouts? No, he replied. Just pain. A few more docs come in and are looking at the screen. They take him to another type of X-ray machine and again are looking in bemusement without explaining anything. You have a blood clot the size of a golf ball floating free in your heart. It's bouncing around the valves and we would expect you to have died very quickly from this. So they give him super strong clot busters. but were concerned it might shrink enough to get jammed. A lot of experts turned up, but all went well, and he had a triple bypass a few months later. That was 30 years ago. He's 87 now, and can walk with these uppity pills. I once had a patient in the emergency room who complained about a foot wound who wasn't healing and something in the wound was wrong. As I started to smell it, I thought, well, here comes another diabetic foot. But then I removed the bandages and started to see fly larvae crawling around. Had to swallow hard. Me, not a doc. Homeless 14-year-old. Finally taken in by a couple who wanted to help plus needed a babysitter. I was so effing grateful. Everything going great. Finally able to eat meals after starving for a few months. One afternoon I lay down on the couch and coughed once kind of hard. About a cup of greenish watery fluid comes out of my lung. Spend an hour or so convincing them it wasn't my stomach. They take me to the clinic. Doc looks doubtful, but has the lab take a sputum sample. We go home. Phone is ringing when we walk in. From across the room I hear get at a hospital now when the dad picks up. I walk into the hospital where a team of 8 kind of throw me on a gurney and rush me to the little ICU. I'm wide awake, totally conscious, and feel able-bodied. They place forth. Bring portable x-ray. Constantly ask how I feel. I'm fine. A bit freaked out but actually finding this humorous shock. I remember the x-ray. Next thing I know, somewhere in the middle of a 4-week ICU residency, I am staring at a heart temperature monitor begging God or anyone to lower my 107 temp so I can get off the ice water mattress. 4 weeks after admission, I'm back to feeling pretty well, but lost what little muscle mass I had and can't walk well. I had picked up Legionnaire's disease from the tray in the air conditioner. No one else got it, but a lot of the apartment complex's renters had been having colds and unusual stomach problems for months before I moved there. I was malnourished and that's why my immune system couldn't fight it off. Always clean your air conditioner thoroughly. You could save a life. Homeless man is brought into the ed by EMS for a foot wound that is giving him trouble. We eyeball his foot that's poking out from the blanket as he's rolling by, and it's a little roughed up, but doesn't seem too bad. We go in to get his story and he says he hurt his foot a few days ago, and that it just hurts to walk on. We ask if we can take a peek. So he whips off the blanket to show us his other foot, the one that is actual hurt, releasing a horrific stench cloud in the process. We knew we were in for a treat. Guy has his foot bandaged in a very dirty ace wrap. Toes are completely black and necrotic, and there's a maggot but wiggling near the edge of the ace wrap. We tried to remove the wrap, but it was stuck together with blood, dirt and who knows what else. So time to cut that sucker off. As we cut, more maggot began to present themselves, and the smell of dead flesh just kept getting more and more intense. We finally make it through and go to pull away the wrap, and I swear at least 100 maggot fell out of that thing. But that wasn't the worst part. The entire bottom of the man's foot was stuck to the wrap and just fell away from the underlying muscle and bone. We told the man we were unfortunately not going to be able to save the foot, to which he responded, "Oh man, really? I didn't think it was that bad." We told the man we were unfortunately not going to be able to save the foot, to which he responded, "Oh man, really? I didn't think it was that bad." I had a patient with a similar sensibility. Story isn't quite as graphic, but it's just as bewildering. Patient came in with an badly infected foot abscess. Entire foot was showing signs of cellulitis, and we had to put her on Vanco for a few days of inpatient care. She was paying out of pocket and kept trying to leave Ask Me Anything, but we kept her for a few days to try and finish the treatment. When the infection was mostly cleared, she was discharged and given ABX prescriptions, appointments to attend a wound clinic to monitor the abscess, etc. Also, we gave her strict instructions to change the bandages, monitor the wound, keep it clean, etc. If it gets worse, call us, etc. She did none of those things. She never picked up the antibiotics from the pharmacy. She skipped her wound clinic appointments. And when we tried to contact her, she had apparently dropped off the grid and was unreachable. We later found out this was because she went on vacation several days after getting home. And after deciding to skip picking up the antibiotics, she decided to go on a 2-week long camping and river rafting trip with some friends. Let me repeat that. She had an open abscess on her foot that was recovering from infection. We told her to keep it dry and clean, and she went river rafting with it. Regardless, the camping trip was cut short after the first week because she developed septicemia and her friends drove her a local hospital which then airlifted her back to our hospital. She survived, but we amputated the leg above the knee. I have never felt less empathy for someone getting an amputation. I have many stories. One is a healthy 23-year-old male comes into emergency room with some chest pain. Normal vital signs. Never smoker. Normal chest ray. Pain started after eating something spicy. Tell him it's probably GERD. 5 minutes later he drops dead in his bed. Start CPR and get a pulse back. Stabilized. Gets cord scan and has an aortic dissection. Dies again in cord scan and never makes it to the OR. The guy's major blood vessel basically just exploded. This happens to men in their 70s with a long smoking history and high blood pressure. This healthy 23-year-old had absolutely zero risk factors for this. No evidence of Marfan's or Ehlers-Danlos for the med people reading this. Still makes no sense to me. Thanks for watching. Consider subscribing for more videos.